Okay, these methods are really, I put it into this, it's really connecting to your entry into community and getting to know the community and establishing the basic issues. So these are some methods in building relationship and community mapping, which is really one of the first phases of getting to know a community. And there will be some overlap again. So the process of working, so community engagement, the process of working collaboratively and through groups affiliated by geographical proximity, special interests, or similar situations to address affecting their well-being. So your goals of communication, community engagement, as with access negotiations, to build trust, enlist new resources and allies, create better communication, improve overall health outcomes as successful projects, and establish lasting collaborations. So the 5 principles for engagement: identify and build on community strengths. So this is particularly stuff for CBPR. So you start where people are at. Issues that matter locally, you meet on their turf and their timetable. And you meet with pre-existing organizations and networks. And some of the questions on the initial things again is who's most respected, and have one of them call the first meeting. And if possible, and if you can do that, establish a base within one of these community organizations and have them host the project. Now, this can be through, in South Africa, many of the NGOs or CBOs don't really have fixed property. And they tend to operate informally from people's homes, etc. But there are often municipal venues that can offer some base, be these libraries or a share in a community hall or a share in a clinic or something like that. Actually, clinics are bad, they're generally overextended. What you have to do very quickly, and particularly in CBPR, is start to get evidence that action can lead to concrete results. So partly you'd be talking about experiences or successes and other frameworks, just to get people on board. But also important right from this first phase is to find out what they've done in the community and how they've operated there, compare that to other communities and just see forward. And build in small successes. So right from the beginning, trying to establish something that is easily attained. So it might be that you want to go in, say at a sex worker project, one of the results that is easy to attain was getting more effective condom distribution. Was it something that the staff also could do from an early basis, using their own resources? And then celebrate each victory. So make that victory feel like it is a success. Because once that starts to happen, people start to feel like they're part of something that's moving forward. And it's more likely to build engagement. And I think I said before, refreshments will be served as kind of or meal provided or something like that. Evaluate constantly. So you need to monitor both process and outcomes. And you build the community members into the evaluation. And as I said about the early successes, so any intermediate outcomes are also important. The fact that you're able to pull all of the different structures together, we'll talk about that as a success. In many of these communities, they wouldn't have worked together. So just the fact of social networking and increasing social capital can be considered a success. Increased empowerment, civil participation, being able to bring in youth is often really useful because a lot of these community organizations tend to operate with older people and there's this huge fear of youth in the community. So being able to draw the youth in. And having the youth, or if you're working with youth, putting them in a position where adults or leaders listen to what they say is also a huge victory. So if you're organising youth and can bring in some of the senior bureaucrats or leaders of the community and have them listen, that would feel like a huge success. And when you're talking about, there's various successes that we usually establish, like reduced prevalence, increased adherence to medication, improved attendance at the clinic, raised HIV counselling, testing, etc. Community members might have different understandings. So it might be reduced stigma, it might be something that they might suggest instead. Or increased clinic hours might be something that they would see as a huge success. Or being able to establish a separate line for people coming in for dots for TB medication, so the lines are not confused within the clinic and would reduce waiting time. Okay, construction of community. Remember that the prerequisite to partnership is to change our vision of the community. We spoke about this yesterday. When we talk about communities, we need to talk about them not as dens of pathogens, ignorance and risk. They need to be saved. So when you go in, you don't talk about it in them as that, but rather talk about from early on about the strengths that you hope to find there and the power that this community potentially has. And to start talking about assets and opportunities for growth and development and how their cooperation can lead to greater development. Okay, that's really just adapting some of what we spoke about in terms of negotiation of access into the engagement, constructive engagement. Okay, asset mapping. And this is often one of the first tasks that you will do when you go into a community. And there are multiple, what you're trying to do when you go in is you're trying to, one, draw out an idea of what the problems are. And you're trying to get a sense of what you can use in the community. So there are other techniques that one might use, and we might probably cover some of them in the next lecture. Things like a SWOT analysis. Strengths, weaknesses, opportunities, threats. There's what's called rivers and stones. It's a fishes and stones. And you draw a picture of a river on the board, and you draw fishes, shapes of fishes and shapes of stones. And the fishes are the positives and the stones are the problems. So you're trying to engage community. What you're trying to do is get a sense of the community, but you don't want to work on a list basis. You have to find a way that engages the community and makes sense to them. So you work with tools that are more figurative in nature. And so one way to do that is this notion of mapping and setting stuff out. Because people, for example, when we work in Delft, you talk to people, they just see Delft as a massive problem. But if you sat them down and said, okay, now I want you just to go through and say, what assets can you call on in this community that are there to improve health? And you'll out a map, and you can then get them to start identifying the libraries, the fresh fruit, fresh produce dealers, the clinics, even the police station, community activists, the churches. All of these are potential assets. So what you're trying to do with community asset mapping is to document the tangible and intangible resources of the community by viewing the community as a place with strengths and assets that need to be preserved and enhanced, and deficits that need to be remedied. So you also don't look at problems as things that cannot be changed. Something will take a lot of effort to change, like the chronic unemployment or lack of housing. Is often beyond the particular capacity of a small grouping to change. But those are longer term things that can be addressed. Having something for the youth to do other than drink and take drugs might be a shorter term target. So what it does is it starts to restructure. So this asset mapping has got a number of functions. It provides information about the strengths and resources in the community. It gives a sense of empowerment and capacity to a community. And it also starts to get the community involved in the real process of research. And this is a research activity. When you do end up with real results, it can be used. So once inventoried and mapped, assets can be used to address community needs. So it starts to really activate resources and promotes involvement, ownership and empowerment. So creating an asset inventory to enable community building, So identify and integrate assets as opposed to exclusive focus on needs. And it's trying to balance the two, because most times when people go in, they're looking at the problems, and that's what people are most familiar with. There's people outsiders coming in and identifying all the problems that exist. So they go through a systematic process for recording the community's assets and how to mobilize these assets and address community-defined issues to build healthy communities through community-informed actions. So it's starting to establish that ownership, but these are assets owned by the community, so they're the ones who would then be mobilizing them. So what is an asset? This can be capacity and abilities of community members. So if they're members with professional training in community and health, that's one particular grouping that can be used. So you can call on doctors and nurses to do health education. You can call on youth workers to provide direction, teachers to assist. It's physical structures, unused buildings, parks, schools, churches, all of these, as well as the formal services of libraries, clinics, etc. Community services for some or all transportation systems. Businesses that provide jobs and support local economies. And this would include informal businesses. And South African communities have probably more informal businesses and more people, in particular an area like Delft, probably more people are employed through the informal sector than in the formal sector. And then local, private, public and non-profit institutions, organizations, NGOs and CBOs. And basically any asset or resource that improves the quality of community life. And get people to think creatively around that. It might be, there's some open fields that could be used, or back gardens could be used for growing vegetables. Okay, it's the capacity and ability of... Okay, sorry, this time I got repeated. Primary assets, building blocks located in the community, so skills, talents, experience, individual businesses, home-based enterprises, personal income, gifts of labeled people.
What do you mean by that?
So, if somebody has a particular skill, so maybe somebody's good at community, good at organizing people. Somebody's good at sewing. So it kind of overlaps to some extent with the skills and talents and experiences. But People might also talk about somebody who's a musician in the community, and they can be used to attract others to meetings. So if they are prepared to sing at the start of meetings or to do fundraising, might be somebody often performers come from these communities. Cape Town's got a large, strong history of jazz, and many of these grew up in poorer communities and have moved out. They've still got families in these communities. So say, Basil Mannenberg, I know he's dead, but he came from a particular area and he could be called to come back and do a performance to raise funds or to promote a particular activity. Organizational assets, associations of businesses, citizens associations, cultural organizations, community organizations, faith-based organizations. All of these can make contributions. Obviously, you will start to look at specific structures for working on a health-based system. But it might be that, example, faith-based organizations often are not considered, but a lot of the healing work and care work is done by church groupings or religious groupings. Even cultural organizations can be called in because they hold a lot of resources within them. Secondary assets, these are building blocks or assets located within the community, but largely controlled by outsiders. We're looking at educational institutions, schools as well, hospitals and clinics, social service agencies, the NGOs and NPOs. Now these, mostly they would fall under control of state services, etc. But schools are often very happy to assist in broader activities. And we worked within the library when we did our study, and we based our office space there. Now, while that's, it's not under community control, and the city council could have withdrawn that permission at any point, but the library was happy to offer that space as a contribution to the community. Public institutions and services, Then potential building blocks. The resources from outside the community and some controlled by outside. So vacant land, commercial industrial structures, empty housing. There's not much empty housing in South Africa, but vacant land could be used for, if it's cleared away, it could be used as a soccer field for youth, get them into more active stuff, more active organization. Wasted rooms can be used for classes. Energy and waste resources, that's welfare expenditure, and there's often welfare expenditure or social services often has budgets that can be used for community projects. So if the community is able to access some of those budgets that are not predefined. Government programs for people with low income, we saw yesterday from David's lecture, useful just making sure that community members have access to child grants and access to disability grants. Infrastructure development, community, you can argue that they get some access to infrastructure, public information. So some of the libraries could be, often libraries have massive amounts of information, and they also often have computers with access to the internet. So that's something that might not have been utilized, that community members can go in and utilize. So what this does is it identifies potential resources. It starts to build internal relationships. So community members might start going to the library and then by talking to the librarians. And you're starting to develop a networks of connection. Establishes external collaborative relationships. So if you start working with the social services, you can start setting up programs that can operate with outside people that will support interventions in the community. Harness valuable individual and collective talents of community members. So there might be individuals that, somebody might have particular skills in gardening, but or in establishing vegetable gardens and they run their own. Now they can be brought into a group, they can maybe help arranging other people set up gardens in their own houses. And that can play quite a big role in just providing some kind of basic food source for these part of the year for those people. Allowing people to become producers rather than problems. It's just a sense of empowerment very often. Building a community vision and developing a shared plan for action towards change. So part of what this does, when we talk about building a vision, is this, it's not just us as the interventionists coming in and having to change a community idea from a place that's full of problems to having full of potential. It's also community members that need to go through that process. And this kind of development of vision can be crucial there as well. And as community members become more engaged in this process and more invested in this process, so they start to dedicate more time and more effort. And that dedication of time and effort becomes more pleasurable because they're now working with people, they're getting to know people, they're establishing friendships, establishing social connections. And so moving out of a space of isolation. And one of the key, and already in terms of wellness and health, another one of the key indicators for health is, or factors to influence health, is the social connectedness of people. And the more that people feel they're part of a social network, very often the healthier they are. Now this has both its own system of, or both operates through a support system. So if somebody does feel ill, there's somebody else to take them to hospital to make sure that they get treatment or to support them through treatment programs. There's also just a general feeling of well-being that comes from being socially connected. Okay, when do you start this process? And you start as soon as you identify the new initiative. So you need to do it as early as possible. When you're doing either when you move into the community or if the community is starting a new initiative and there needs to be a new identification of assets. Because it allows you to make program decisions and allows you also to do a healthy community assessment. It encourages communities to take pride and responsibility for their concerns. Okay. So all of these are motivations to do it really early. Sorry, there's a lot more repetition in these slides. Okay, what are the preparatory questions before you go in? Now when you start mapping, at some level you might do a complete mapping of the community. But you might also focus it very directly on one or two key issues. So if the concern is around diarrhea in children, you might want to map fresh water sources, clinics, pharmacy where they can get resources, places where Yeah, so there might be an emphasis on those, nurses that live in the community or other health workers, community health workers live in the community that can assist if a child does get ill. So you might map according to your specific need, or you might map very generally around within a community. You also need to look at what you want to do with the results. Is this to mobilize for action? So you might want to mobilize around getting additional facilities, then you'll want to mobilize around exactly how many toilets are so you can see where these gaps are. I'll talk about it later, but sometimes this asset mapping goes in line with risk mapping as well, in which case you'd be balancing the two. What is the size of the community? Are you working from a province, a town, a neighborhood, an informal settlement? So you do need to set geographical boundaries. What people are available to do the work. If you're just in the early phases, you might still be reliant on fieldwork staff, or you might be able to use some community members. And you pay them a nominal amount to do this work. Do they do it free of charge? Are you working with youth, with elder people? How much time do you have, or how long can you allow? What are your deadlines for operation in this community for doing this task? And what financial resources can you rely on? If you've got funding from external source, then that can be used, but very often you have to rely on what is existing in the community. Okay, the steps to planning asset mapping: define the community boundaries, identify and involve the partners in the community in doing this, determine the type of assets to include, and start to list the assets, or the groups or individuals, and then organize them on the map. Go through that a little bit in more detail. It can include, and just in terms of methodologies, it can include making a survey, which you can take to masses of people, dropping off surveys at various locations, do door-to-door surveys, telephone surveys. You can run a focus group of key informants in the community and get them to talk about it. Windshield surveys it's a particular Americanism, but again, putting surveys underneath windshields and asking people to respond. Drop off the surveys in a central place where they would list assets as they could be. Walking tours, so just walking through a community from one end to the other and just noting everything that you see. And that's part of what we did when we went into Delft and we were looking for the shebeens, is we literally just walked the streets and talked and spoke to people. And it would be pointed to a shebeen and just go in and have a look. Some cases they reasonably obvious, but mostly they're hidden behind closed doors and would be behind a house, or within a house or in a garage or something like that. Okay, defining the boundaries. You want to set geographic boundaries, and that's often the easiest. You can define it according to the community that you want to work in, or it can also be particular groupings, in which case you'd boundary then by giving the definition of the community, of the grouping that you're wanting to work with. And it's a good idea to use our residents to define the boundariness of their community. And you might find that as you work, there are different boundaries might exist within a community. So within Delft, it was very interesting because although Delft is a single community, there were clearly sub-communities. There was old historical communities of Roosendaal and that saw themselves as slightly separate from the newer communities. There was the racial division of communities, although there were quite a lot of overlaps there. But Delft South has definitely seemed different from the other parts of Delft. Then there was Blikkiesdorp and Tsunami, two informal settlements. And they're seen as being very different again. You might have to map them slightly differently. And when you go in and trying to organize, you need to define how you're going to work within that. Okay. So as you go through, you'll start to, now there'll be some stuff that people will automatically and from the first meeting start to identify. Maybe clinics, etc. But as you do walkthroughs or as you talk more, or as you network, more stuff will be identified. These might be market, in this case they talk about coffee shops, but in local country it might be open market, informal markets. Some of the drinking venues might be networking places where people meet and could be used as a resource. Very often, a number of these places, they really only sell alcohol at a major level on weekends. So maybe they could be used as venues for community meetings during the week. So just being creative around that. Looking at marginalized subgroup gifted people. So I've adapted. Idea of undocumented soup kitchens. So there might be specific food sources for people that are in need that could be identified that might not everybody will know about. Okay, you need to find the people to work with and have shared interests in this process. Involve those with different networks, knowledge of resources, residents and problems. So it's a idea to involve as many stakeholders as possible from different sectors to get a good access to. So for example, if we worked with older people in the community, we might miss some of the specific youth resources, such as game shops or cafes that have a back room where they meet and chat. And if you involve enough people, you can really start to develop a comprehensive process. Determine the types of assets to be included, money and access to economic resources, physical assets, knowledge, skills, and political connections. Identify specific skills or assets that need to address. So you'll be looking generally, but you might put additional emphasis and collect additional information on assets that have a specific focus on the area of work that you do. That doesn't mean you exclude some of the other assets. You might hold them in the back of your mind, or they might come in more important in later developments. So, and begin by creating a list of those groups that are known. Use partnerships, and as you've been walking through, to build on that list. Go talking to local businesses, talk to people in the area. Everybody's got different ideas, and particularly some of the hidden assets like individual skills. You might end up having to go and talk to them to be able to access that. You might have to talk. Somebody will say, no, we'll be able to tell you about another person who's got specific gardening skills or cooking skills or sewing skills. Now go back to those discussions around the orphan and vulnerable children yesterday, and a woman identified themselves as having sewing skills, so would start to do that. Start to sew the tracksuits and getting clothes for the street kids. Other cases, you might be looking for clothes and then would ask communities to identify people who can sew. And gradually those would start to emerge as additional assets. Okay, there's I'm getting ahead of myself to some degree, can be challenging in many more people and groups. So, and yes, to some extent, asset mapping is also not a closed process. It can continue to develop over time, and as the needs of the project change, and as if you do, say we were talking about doing something for orphans and vulnerable children, and a sewing group develops. The group might start with a group of 5 women. One or two, let's chuck 1 or 2 men in and not be sexist. Particularly in the history of Cape Town with the clothing industry, where a lot of men were involved. Over time, this group gets to be known. So more and more people come to volunteer and become part of it and contribute skills. And so that allows some people, when they're bored with it and want to do something else, they can move out and others can take over. It maintains a long-term process. So you don't close the process of it. Now there are defined, you can set up a defined methodology of going house to house, taking on resources, or you can do it more informally. And this is really something that you would need to do and to set up and determine as you're going along. You then get to the process of organizing assets formally onto a map. And this is really just trying to get a sense of the spatial orientation of it. Some stuff cannot be mapped, like individual skills you might be able to map where the person lives, but those might have to go as lists attached on the side. And it also, it starts to highlight where there are gaps in the area. So it illuminates if there are concentration of service overlaps, gaps in service, unmet community health needs. You need to make sure it is clear. And people talk about, have specific icons for each kind of asset. And a specific legend of what each of those mean. Going back to what I said earlier about being organized and clear. The more you can do that and be 100% clear of what everything means, the more likely it is to be actively used. And there is an attraction of these kinds of processes. People do look to them, and then it starts to make sense. A lot of people operate very visually, and particularly in poorer communities, where there's a less verbal skill, less reading skill. These verbal orientations can be very powerful. And these are just some examples. So in this case, it's working from a very formal map of the community that could be obtained from Google Maps or from the municipal services. And it's actually a very useful resource in South Africa. Most of the municipalities can offer you large-scale maps of the communities. And when we went into Delft, we got 2 or 3 of these. Probably the whole map probably was the size of all of those 4 tables together. So, but the advantage of that large scale is you can get detail. You can get down to individual house details, which is what you've got here. Then just use the yellow stickers to indicate where resources are. Or you can draw directly onto it like that. So the red squares are healthcare, yellow are churches, round purple circles, blue circles, community resources, and triangles, diamond shapes. So you can start to get a sense of what each of these actually mean, and you get a sense of how they're distributed around the community. So you can really see here that this area has got a very little of our health resources. They mostly seem to be concentrated around here, with 1 or 2 spread out. There's very little below the river. But there does seem to be churches are more evenly distributed. I'm not sure what EPA site is actually, but yeah. Or you can just go down to drawn. Just draw a map for yourself. And what's very interesting with this is what happens to scale in these drawn maps. They very seldom stick to scale. But you'll start finding areas being made larger if they're more important, etc. And the advantage of that is you can then rub out and redraw and scribble over and all of that. And that's more or less what we'll try and do this afternoon, is just work from, just do some hand drawing of the maps. Okay. Including remarks just around this, builds the mapping builds and strengthens communities from the inside. A positive approach endeavors to identify and integrate and maximize the potential of individuals in a community. Can be a guiding force behind building healthy communities because it establishes and begins at a very early stage to empower the community members. Regards the community not as a complex mass of needs and problems, but a diverse and dynamic web of assets. So it starts to really give a community a sense of the potential. So just to look on the one side, this is as a negative image. If you see the community as this part is domestic violence, alcoholism, AIDS, dropout, homelessness, abandonment, child abuse, a really depressing image to look at. This is something like that, which starts to give a real sense of, well, okay, these things do exist. Obviously, that's a highly stylized process, but just to give you a sense of, the one gives a sense of really depressing, the other gives a sense of real hope. Now, advantages. So advantages are built on existing community assets. Mapping indicates a visual depiction of existing and lacking assets. The data will raise awareness about the availability and develop or improve services or where to apply for funding for, what to apply for funding for. And can generate a lot of community participation, because this is something that communities, you're talking about empowerment of community members. This is something you don't know the community. Community members are experts in the community. So while you can give ideas of how to go about it, this is the area where the community is expert. And they're the ones who then need to go out and collect the information. So it immediately draws in community participation and the development of that. And disadvantage of finding the right maps can be difficult, and particularly if you're working with these large maps. Sometimes they get cluttered, it can get really messy. Some stuff can be difficult to map if it doesn't have a physical location. Mobile clinics are one example. Individual assets, individual skills are another example. It's quite difficult to map. And there you might just need to do a list next to it of additional assets. You do need to get community buy-in. The success of this does depend on how well you did your community engagement and your negotiation of access. Because if you've done that badly, then this could end up falling very flat if you identify nothing. Okay, on the other side there's the risk mapping. So, and this is often drawn, but it can also be done on a process where, like, draw the neighborhood, including everything, streets, alleys, businesses, like label everything. And it's very much the same sort of process as the asset mapping. Again, you'll use a legend to mark where the different, so maybe the green will be used in this case for physical hazards, noise, heat, cold, electrical, red for chemical, dust, fumes, gases, vapors, I'd include, go back to the diarrhea example, where there's standing water with fecal content. Example that David spoke about yesterday of the path where all the fecal matter was left. Hazard relation to physical exertion or ergonomic. Hazard related to stress, long hours, personal tensions, domestic violence. Might be additional things, particularly working in a community setting. Busy roads might be a particular hazard. There's areas with a lot of gangs or drug dealers, might be another risk. And then you can also prioritize these hazards. Some that are easier to correct and some that are more complicated. Again, if you can identify those that are easier to correct, you might be able to find ways to get early successes by starting to address those. List items that need more information, investigation. Also enables you to set priorities for research. And it's often best to combine these two. So you can look at relationships, look at balances of forces, you can use assets to reduce risks, and how to build assets in relations to risks. So if there are particular areas where diarrhea is at a higher level, maybe to make sure that educational material is distributed there, or to have a permanent educational board situated somewhere in that section. And just, if I go on, and there are different processes one can use to be creative around this. And in another study that I read, they got children to identify. They got children just to draw pictures of their local community or of places that they were worried about in their community. We found that this very often related to, a number of the drawings related to street corners. And this is where the youth would gather. And the children often felt unsafe walking through them because sometimes they would take their money. So, or places where bullies were identified. One also needs to look at where their assets are also risks. So a park might be an asset, but there might be risk associated with it. That park might be where drug users go to smoke their crack or smoke their tip. You don't really in South Africa have an issue of injecting drug use. But if people are injecting in a park, they might find used needles lying around, which then makes it a threat. A park might also have broken equipment. So the park itself is an asset, but there's a need to go and redevelop the equipment. And often something like that, where something exists as both, provides opportunities for early success. One can then take advocacy action to the municipality to come fix the equipment, or one can recruit members of the community just to go and, where somebody has particular skills, to fix the things or to fix certain pieces of equipment. Or to clean out pull together all the youth, and they can go and clean all the pollution and rubbish in the park, so it can become fit for children to play in again. So this kind of process provides action, and motivation for action. So it can be used to stop evictions, can be used to advocate for services. It can raise awareness of resources and can get communities directly involved in taking action to improve things for themselves. And then the additional tools and ideas that can be used. You can work, and these are just, as I said, some of the things I spoke about earlier, formal municipal maps, GPS and Google Maps. So just where places where you can go. Photographs, and often it helps, if you've got a map, when you're talking about an asset, is you can have a little number and on the side have a photograph. So you might have a clinic and a photograph of the entrance to the clinic, or a park and have a photograph of the park. So people can get a spatial awareness as to what is going on. And you might even use that as a way of showing successes. You might have this park as it originally existed, and the park as it was after you cleaned it up, and becomes a kind of trophy cabinet for the community, so they can see where stuff is developed. You might use a different legend for old assets and new assets. You can people see how assets are developed. So it needs to work creatively with this process to try and use it. And this is partly what I'm talking about, and I can talk about these methods, but one has to then adapt them and apply them for a particular construct, and to make them applicable for the grouping that you're working in.